All right, so today we're going to do something a little different. We're stepping right into a doctor's office, basically shadowing a specialist as they assess a young child with Down syndrome for the very first time. We're going to see exactly what they're looking for, the kinds of questions they ask, and how they start to build that all-important plan for care.
So right off the bat, this one sentence tells you everything you need to know about the stakes here. This is not your average checkup. Think about it, a child, a year and a half old, who's basically been off the radar of the medical system since they were born. This first meeting, it's absolutely critical. It's the starting line for understanding their health and, frankly, getting them the support they need. So let's break down what this crucial first assessment looks like. We're going to follow along step by step as the doctor confirms the diagnosis, looks for any red flags or common issues, and gets a feel for the child's development. The whole point is to get a really clear picture of what this little one needs to thrive.
Okay, so where do you even start? Well, just like you'd probably guess, it begins with a general physical exam. The first order of business is just to look for those physical clues, the characteristics that are typical with Down syndrome, and just to get a general sense of the child's overall health.
And this is where the theory stops and the hands-on examination begins. The doctor's looking for those classic telltale physical signs. So, what exactly are they seeing? Right away, the specialist zeroes in on a couple of key things. First, they look at the hands and notice something called clinodactyly. It's basically a curve in the pinky finger. Then, there's a much broader but super important observation, hypotonia. That's the medical term for low muscle tone, and it's a real hallmark of the condition. The initial check doesn't stop there. They also see a growth delay. The child's height and weight are below average, which is pretty common. But what's really interesting is that it's not all just about physical measurements. The doctor makes a point to note the child's mood, that he seems very happy. And that's not just a nice little aside. It's actually a clinical note, something that fits into the overall picture of Down syndrome. All right, so once the outside check is done, it's time to look under the hood, so to speak. The specialist starts a system-by-system review of the body. This is so important, because for a lot of the common health issues that can come up, catching them early makes all the difference. And first on that list, the heart. The cardiovascular system is always a top priority, a major area of concern for kids with Down syndrome, so that's where the internal check begins. So they're not just listening for anything. They're screening for specific heart problems. Do you know what one of the most common ones is that they're looking for? Well, it's something called a ventricular septal defect, or VSD for short. And all that is, really, is a hole between the two bottom chambers of the heart. And because this is so common, sending the child for what's called a 2D echocardiogram, basically a detailed ultrasound of the heart, is pretty much standard procedure. Okay, heart check is on the list. The systematic review keeps rolling. And next up are the abdomen and the musculoskeletal system. Everything to do with bones, joints, and muscles. And remember that low muscle tone, the hypotonia we mentioned earlier? Well, this is where it comes back into play. The doctor now has to wonder, could that low tone be connected to another problem, specifically with the hips? So they do this really quick but effective physical test right there in the office. The doctor looks for any uneven skin creases on the child's thighs and then gently checks how well the hips can move. And in this case, great news! Everything's symmetrical, the range of motion is good, so for now they can rule out hip dysplasia. All right, what's next on the checklist? That would be the endocrine system. This is the system that manages all the body's hormones. And yep, it's another area where you've got to be on the lookout for common issues. And just like with the heart, they're screening for a very specific condition. So, any guesses what common thyroid problem they're looking for? The screening for this is actually pretty straightforward. The doctor will feel the neck to check for a goiter, which is an enlarged thyroid. They'll test reflexes, and a big part of it is just observing the child's energy level. And the result here is good. The child is active, seems to be doing really well, with no obvious signs of hypothyroidism. Okay, so we've covered the body's internal systems. Now the focus pivots. It's less about the hardware and more about the software. How is the child actually functioning and engaging with the world? This means it's time to look at their development and, of course, their senses, like hearing and vision. Now, since this little one isn't talking yet, you can see why checking their hearing is so important. They use a simple but clever method called the distraction test. Basically, an assistant makes a quiet sound, like a rattle, just out of sight, and the doctor just watches to see if the child turns their head to find it. They do it for both ears, and in this case, the child responded perfectly.
And this leads us to one of the most important findings of the entire assessment. After watching the child's motor skills, for instance, noticing they can't sit up on their own yet, the specialist makes a critical judgment. Even though this child is a year and a half old, developmentally, they're functioning more like an 8 or 9-month-old. That's a huge gap, a really significant delay.
So, at this point, the exam itself is pretty much done. But now comes maybe the most important part of all. Taking all these little pieces of information, from the physical signs to the developmental notes, and putting them together into a real, actionable plan to help this child.
So let's just quickly recap what we've learned. The doctor confirmed the physical features of Down syndrome. The big takeaways are that significant developmental delay and the low muscle tone. But on the upside, those initial checks for problems with the hips, belly, and thyroid all came back clear, which is great.
And all of that information leads to a very clear game plan. 3 key referrals. First, off to a cardiologist for that heart ultrasound. Second, to an audiologist for a proper, formal hearing test. And third, to an ophthalmologist for a full eye exam to check for things like glasses, cataracts, or other common issues.
You know, I want to bring this quote up again. He's in a very happy mood. It just really drives home that a good clinical assessment isn't a checklist. It's so much more holistic. It's about seeing the whole child, from their physical health right down to their personality, to create a truly complete and, compassionate understanding.
So this entire assessment, really, it's the new beginning for this child. It sets the baseline, it draws the roadmap, and it leaves us with a really important question to think about. What does that lifelong journey of proactive and supportive care actually look like from here on out? How do you help this child tackle every challenge and reach their absolute fullest potential?